Hey guys, hope you're well and hope you enjoyed your Easter holiday. Today we have Dr. Sule on set. Let her say hi.
Hi everyone, my name is Dr. Christina Sule. For those of you who don't know me, and thank you so much, Catherine, for having me.
Welcome. She's always a guest in our YouTube video because I like learning and I like sharing about women's reproductive health. And in today's topic, you're going to talk about menopause. I'm very excited. It's something that is very close to my heart. 40 is nearing. I'm not saying that's when menopause starts, but it's just a topic that I like to know more about, to understand it better. When I talk about menopause, I always think about what I've seen in my short span of life. I've seen women going through it, and it's not something that it's easy for a woman to describe. I think it's different for every woman. And today, Dr. Sule is here to bust the myths and just to be more clear on what menopause is about and how it manifests in women. And whatever questions that you guys are asked, we're going to answer today. We'll try our best. I know it's a very, very huge topic and there's a lot to talk about, so we'll try and just give you the basics, and I'll start by asking Dr. Sule to define what is menopause.
So menopause is basically when a woman stops menstruating, but there's a timeline to it. So it's when a woman has stopped menstruating for an entire year. So it's a retrospective diagnosis. It's something that you can only say looking, retrospectively, like it's been a year since I've had a period, so therefore now I'm in menopause.
Okay.
And the reason why we give it a full year is because towards menopause you can have your periods missing a lot. So you have a time when you have a period, 2 months you don't have it, then it comes again, then 4 months you don't have it. So when it's been a complete year is now when you're completely in menopause.
Officially in menopause. Okay, so thank you, Dr. Ari, for that definition, and I'd like now to go into what exactly happens to women's body during menopause, and this you're going to give us a little bit of scientific explanation of what exactly, other than your periods stopping for 1 year, what exactly happens to our body.
So during menopause, the major thing that happens, aside from many other things, and the major thing that causes all the symptoms that we now see is the decline of estrogen. When estrogen declines, all these symptoms come about. And the estrogen declines because the ovary starts to produce less and less of estrogen, and during menopause it can produce very small to no amounts of estrogen. Yes. And of course our follicles get much less. There are very few now follicles in the ovary, which are also responsible for estrogen production. So when estrogen declines is when all the other symptoms come about, and now it's a chain reaction.
And when the guy is saying symptoms, I just like to put a disclaimer there. We definitely have general symptoms that most people experience, but everyone's menopause experience is different. I don't know if it's genetics sometimes, where you find that some people do have very strong symptoms when it comes to menopause. So everyone's different, and that's what I'm saying. If you sit here today, Dr. and talk about all the symptoms, we'll be having a 5-hour video. So we've narrowed it down to a few symptoms which Dr. is going to explain and which might happen to most women, and that's where we are going to start talking about the symptoms. So Dr. is going to focus on 4 major aspects when it comes to menopause, and I think she'll start with osteoporosis, which affects many women, and she'll go deep into it.
So osteoporosis is basically a skeletal disorder, and it's where the bones start to lose their density. And that's very important because sometimes even when you do an x-ray for a woman who has osteoporosis and maybe she's in menopause, you find that an x-ray of a person who's younger or a person who does not have osteoporosis, the density of the bone is much thicker than a person who has osteoporosis. And estrogen has a really big role in preventing us from getting osteoporosis. So when it starts to decline, like in menopause, you find we get more of osteoporosis, and the problem with that is that it leads to bone fractures. So it makes our bones weak. They're not as dense as we want them to be. They become weaker, and we start getting fractures. And especially for women, the most common type of fracture they get is a hip fracture. So that's why you'll find very many old women have a hip fracture or need a hip replacement, and so on and so forth. So osteoporosis is like one of the most serious and dangerous things that happens during menopause.
So we have to be careful, take care of ourselves, avoid accidents, and not to stretch our bodies too much when it comes to exercise. We also have to be careful the kind of exercises we are doing, because our bones are much more weaker and more prone to breakage than before menopause.
Exactly.
Okay.
Yes.
So ladies, that's one. And I think some of these symptoms, like what you're talking about, is life-threatening. So those you give priority to such kind of symptoms. Okay. Next, after osteoporosis, those are the symptoms to look out for.
So basically we have bone pain. Those are some of the symptoms that you'll get, like hip pain, back pain, knee pain. Those are some of the things that older women will now start complaining about. And when that happens and they see their gynecologist or any other doctor, actually, the doctor has to do some investigations, because we need to see, is this actually osteoporosis? Maybe it's arthritis, it could be something completely different. And so that's the time when the doctor will probably do an x-ray just to see what's going on in the joint, what's going in the on in the bones. And at the same time, they may want to do other tests like vitamin D3 testing, your calcium levels testing, your phosphorus levels testing, in combination with the x-ray, so that then they have a clearer picture of exactly what's going on. Because sometimes you may have back pain, but it's actually a nerve that's having a problem. It may not be the bones. But for older women, it's really important to establish whether they have osteoporosis or not. Yeah.
Okay. And like you said, there are a lot of investigations that take place before you can give a diagnosis.
Yeah.
So, doctor, what is it if you have diagnosed that patient and they have osteoporosis? What is the treatment? What are the measures they're supposed to take now to deal with the condition?
Yeah, so we do have measures that we take even to prevent the osteoporosis from happening, because that's very important. Yeah. So women around the age of perimenopause and over the age of 45 should take their vitamin D3 supplements. They should take their calcium supplements. They should do strengthening exercises, things that are more likely to strengthen muscle and bone. And that is a way of preventing osteoporosis from happening altogether.
Or slowing it down.
But once it does happen, there's many medications we can use, like biphosphonates. Those are some of the medications, and even the supplements themselves that not only prevent but also treat osteoporosis. Of course, if once it happens and the person gets a fracture, then they need an orthopedic surgeon to be able to deal with that fracture surgically.
And I've seen, like, sometimes, especially for women who are in menopause, if they have a fracture, it takes longer to heal.
Much longer, you're right.
Much longer to heal. I'm talking about that because I'm mentioning that because my mom broke her leg and it took a lot of time. She just slid when she was leaving home, and took a lot of time to heal compared to if you were younger. It's just something I've noticed. That's true. So that's how you can treat osteoporosis, or even prevent it or slow it down. So after osteoporosis, we have another condition that is life-threatening also, and Daktari is going to talk about it. Life-threatening, especially when women are menopausal. So the next condition is cardiovascular accident, and Daktari is going to talk more about it and expound on it.
So what happens in before menopause is that estrogen tends to protect our cardiovascular system a lot, and that's why women are actually less prone to getting strokes and heart attacks and such conditions, because they have estrogen, so we're already naturally protected. Now when it starts coming down, then our risk for developing high blood pressure, for developing heart attacks or myocardial infarction, for developing a stroke becomes much higher. At the same time, estrogen protects our lipids from rising, so the bad fats in our body, estrogen protects that from rising. So when estrogen starts coming down, then the bad fats start increasing, and it causes more obesity, more abdominal weight to start forming, and it makes us more predisposed to stroke because more fat starts to accumulate inside our blood vessels and around our blood vessels and around the heart. So that's the other thing that can happen. Also with cardiovascular accidents, when estrogen declines, women tend to be more predisposed to glucose intolerance, and they can become diabetic. So you can imagine how much protection estrogen offers.
It does
in that aspect.
It does a lot. So Dr. Sule will expound on some of the tests we can take, or some of the tests that can be performed on women who are menopausal, so you can determine your cardiovascular condition and just to prevent any cardiovascular accidents.
So some of the tests that we do when a woman comes in for menopausal care is we can do a liver function test, we can do a kidney function test, we can do an echocardiogram, we can do an electrocardiogram, which is an ECG, and these are some of the standard tests that we need to do just to determine is there any cardiovascular risk or accident that's about to happen. We can also test the level of cholesterol and all the other fats, which is called a lipid profile. It lets us know, like, are you at risk of getting, a stroke because your lipids are raised, and especially we're looking at the bad lipids being raised more than the good ones, because we have good and bad ones. And these are some of the tests that we do, and this actually should be standard of care for menopausal women to be able to determine whether they're at risk of cardiovascular accidents. Of course, at the same time, we want to see, are they taking any other medication that could predispose them to this as well. So we usually take a full medical history, we do a good examination, and then is when we go in for those tests.
And also the stress test is one of them.
Stress test is also one of them. Yes, we want to see how much stress is your heart able to take even at that old age.
Okay, so it's a lot of pre-care before post-care. It's a lot of that. Okay, and if you find that, okay, maybe a patient is at risk of cardiovascular accident, or maybe just to prevent that, what are some of the things that a menopausal woman can start doing to prevent or even to just deal with a cardiovascular condition?
Okay, so in terms of prevention, of course, diet plays a very key role. Avoiding high fat foods, high sugar, alcohol, of course, avoiding smoking and drugs. Those are some of the things that can be done to prevent that from happening. Increasing their activity, increasing, exercise, getting enough sleep, avoiding stress. Those are all things that are important in preventing. We also have certain medications that can prevent that. Like we have medications that decrease our cholesterol levels. If you already been noted to be hypertensive or already have a cardiovascular condition, then of course you will need extra care. You'll need extra care and you'll need treatment for that as well. And those are some of the preventive measures. But one of the things that we do offer specifically for women who are in menopause, we do offer them hormonal replacement therapy. That's one of the things that we offer them. And hormonal replacement therapy is where we add back the hormones that are now coming down because of menopause. So we're giving you back estrogen in a medical or pharmaceutical form because your body is not able to form it on its own. Yeah.
Okay. And when we talk about hormone therapy, there are very different ways of infusing,
providing it,
or infusing estrogen in a woman's body. There are many ways. I think there's a patch, injection, pills. So there are many ways. But you have to go to a doctor and they determine what's the safe way of doing it for you. What's the safe way of doing the hormone therapy for a menopausal woman? Okay. Next condition.
It's actually very important to find out about the safety because hormonal replacement therapy can actually be very dangerous. And we have people who are not supposed to get it, and then there are people who are good candidates for hormonal replacement therapy. So for those who are not supposed to get it, for example, if you have an active liver disease or you already have a heart disease, or maybe you have a breast disease, or maybe you have bleeding that has not been diagnosed and you're already in menopause, those are things that you need to avoid. We need to see the profile of the patient. Like, do they have any pre-existing condition that could make hormonal replacement even more risky to them than what it would have originally offered? And at the same time, we don't give it to women who have been in menopause for more than 10 years, and that's really important because if you've been in menopause for more than 10 years and you receive hormonal replacement therapy, it puts you at a higher risk of cardiovascular accidents. Yes, so it needs to be less than 10 years, and also you shouldn't be over 60 years of age. If you're more than 60, then you're not a very good candidate for hormonal replacement therapy. We like to give it to ladies who are under 60 and at the same time have not been in menopause for over 10 years, and that way it's safer for them.
So you have to see a medical expert. You have to seek professional help. Do not do it for yourself over the counter. I don't know if we have these pills available, but I think you have to be prescribed for by a doctor. So ensure that you go see an expert. Do not self-medicate. Make sure that you're getting expert professional help. The next syndrome is genital urinary syndrome, and Dr. is going to expound on that. That's another condition that we have to be very careful when it comes to menopausal women.
So genital urinary syndrome is a collection of symptoms and signs that patients get, especially when they are headed towards menopause or already in menopause. Again, it comes because of lack of estrogen, and these symptoms are mainly in the vagina and in the urinary system. So basically what a woman goes through is changes anatomically in her vagina, and what happens is that the vagina gets shorter. It starts to produce less of the lubricating fluids that are usually produced when you have sufficient estrogen. It gets a lot drier. The lining of it becomes much more thin and fragile. Women who do have this are more predisposed to painful sexual intercourse, tearing during sex, and then the vagina generally is ribbed, so the ribbing of the vagina tends to go away, and the vagina becomes smooth, and the blood vessels are much less. And then with that, they get lots of itching, lots of dryness, lots of vaginal infections and urinary tract infections, because we do get menopausal changes in the urinary tract system as well. So when all these changes are combined, they cause genitourinary syndrome, which is just that collection of all those changes
and all those symptoms. And it's not life-threatening. It's not a life-threatening condition, unlike the two we've spoken about, osteoporosis and cardiovascular accidents. But it sounds like it's all doom and gloom, but that's why we are here to do this video, so that we try to manage if you do get those symptoms, if you have one of those, we are trying to manage. So what we are trying to do is improve the quality of life, even if you're going through menopause. So it doesn't sound all doom and gloom. What Daktari is trying to do is to be very clear of what these are things that can happen. So someone watching this, don't be so scared. It's a natural process. Most women go through it, and that's why Daktari is here to tell you that this might happen, and to show you and to give you option that these are the things you can do to be able to manage that care. And that's our next step, and that's our next conversation. What can you do to be able to manage that condition, and what care can you give a menopausal woman who's experiencing all those symptoms you've talked about?
So unfortunately, genitourinary syndrome of menopause cannot be prevented. But just slightly over 50% of women complain of these symptoms. So there are those women who are menopausal who actually do not have these symptoms, but more than half of women do have these symptoms, and there's no way to prevent it, but we can treat it. One of the ways to treat it is to provide hormonal medication. This can be in form of a gel or a patch, so that the lubrication is retained in the vagina, and so that it can be restored. But the problem with that is that, as I mentioned, hormonal replacement therapy is risky, and sometimes it can put you at risk of breast or endometrial cancer. And so we do offer it to patients, for example, who have very severe symptoms. We do have some non-hormonal methods that can be used, but they're not as effective as the hormonal ones, unfortunately. And then we have those that are more towards the cosmetic gynecology part of it, and those are the ones that many more women are starting to prefer, because they do not involve hormones. At the same time, they are not medications, but they're treatments that are showing incredible results. Like, for example, radiofrequency vulvovaginal rejuvenation, what we offer at Alora Medical Practice, which is the EVA treatment, the enhancer of vaginal anatomy. So basically, you have radiofrequency heat energy that is inserted into the vagina, and it allows the vagina to start producing new blood vessels for the lining of the vagina to get much thicker, exactly, for the pain to be relieved, for the itchiness to be relieved, for the tightness to be restored. So it really enhances and treats a lot of the vaginal anatomy that has been distorted by menopause, and it's an excellent treatment to restore not just the tightness but also the lubrication and to eliminate the symptoms of genitourinary syndrome. It also treats the incontinence that sometimes women get in menopause, where they cough a little or they sneeze a little and they get a little bit of urine escaping. So the stress urinary incontinence can be treated in that manner as well.
So that means there's no hormone replacement. It's more natural, and it doesn't put you at risk for cardiovascular accidents.
Exactly.
I've done the EVA treatment myself, and it is true. You're more lubricated. You feel more tighter, and for me, I feel like it's a more safer way and doesn't expose the woman to many other risks that comes with hormonal therapy. So we're going to talk about the fourth condition, and something that is it puts women at risk when they're going through menopause, and that's the different cancers that women can tend to suffer from.
So menopause comes with a lot of challenges that we've explained, but it also comes with a higher risk of getting the reproductive cancers. We call them reproductive because they affect the reproductive tract. Of course, menopause does predispose us even to other cancers, but the ones that are of interest to us as gynecologists are cancer of the cervix, which of course you can get at any age, but you are at a higher risk in menopause. Cancer of the endometrium, which is the lining of the uterus, one can get cancer of that. Ideally, when a woman bleeds after menopause, that's the first thing that her gynecologist has to look at. So it's been a year since she stopped her periods, and now all of a sudden she's bleeding. That's the first thing the gynecologist needs to check. Is she having endometrial cancer or not? There's also the risk of ovarian cancer that comes with age, and breast cancer as well.
Okay. So what? So I'm sure there are testings. There's some tests you can recommend women who are going through menopause to do, so that you can be more alert in case a woman tends to get some of these cancers. So as a gynecologist, what tests would you recommend for a woman who's going through menopause, and how frequent should they have it?
So in addition to the tests that we mentioned before, the bone tests, the cardiovascular tests that we do recommend for women to go through gynecological cancer screening. This ideally should be standard when a menopausal woman goes to a gynecologist. So basically here we're looking at doing an ultrasound, and what the ultrasound does is that it lets us know the lining of the uterus. How thick is it? If it's thicker than what it should be, then there's a likelihood after menopause that this woman has endometrial cancer. At the same time, it will let us know what the ovaries are looking like. If there's a mass in the ovary, then we can start to suspect that this could be ovarian cancer. So that's the major information that the ultrasound will let us know. Of course, it's very important to do the pap smear, especially if the woman is under the age of 65. Where we do the pap smear, or even the co-test, where we do a pap smear and we test for HPV at the same time. After the age of 65, if the last 3 pap smears have been normal, there's no need to continue with pap smears. But if you're under 65, you have to keep doing your pap smears regularly, or to do the co-test. And then of course, last but not least, is the mammogram. If you're in menopause, you must have your annual mammogram, and just ensure that your breasts don't have any masses that could be suspicious. And once that is done, then you're kind of safe to say that you have a clean bill of health. But that doesn't mean that you stop the screening and you stop taking care of yourself.
Okay, so I think that's why we've decided to focus on these 4 conditions that can happen during menopause. There are so many others. Like we said, every woman is different, but these are the ones that are 2 of them are life-threatening, and the other 2, actually 3 with cancer, and then the other is just the quality of life reduces. Women tend to have difficulty enjoying sexual intercourse. So these are the main conditions to look out for. And like Jashari says, as a gyna, she works with many other medical experts. We have bone doctors, we have cardiologists, we have physicians. So it means just taking care of your health, making sure that it's something very personal. No one can do it for you.
That's true.
And once you know the risks, once you know the condition and the symptoms, then you're more aware. So Tashari is also going to mention some few minor symptoms that do occur during menopause and different women. Again, we says menopause manifests itself differently for every woman. There are genetic factors, environmental, like he says, how are you taking care of your body when you are younger? All these factors come into play. So Tashari is going to talk about, not necessarily say minor, but some symptoms that are not life-threatening, that women have 50% or more have experienced during menopause.
So one of the symptoms that are not life-threatening is like the hot flashes. Women tend to go through that a lot in menopause. They are more severe for some women and not as bad for others. But even before I mention anything about it, I'd like to say that they do get better with time. They do get better with time, and that's really important to know, because sometimes when they start, the woman feels like it's the end of the world.
No, it does. I've seen it. I've seen how women sweat. Some have to do different clothes, like multiple clothes changes, especially in the beginning, like you said, sweat a lot at night, and so it does get better, to be honest. I've seen it getting better, but sometimes when you're going through it at that moment, you feel like this, it's hell. And the good thing is that it does get better, but initially it can be quite serious. So it really depends on how the woman is feeling. Like, does she feel like this is something that she can manage, or is it completely unmanageable? There are those who are unable to go to work. They get to work, they're completely drenched. Your quality of life is affected.
Exactly. So there are some who say, yes, I do get hot flashes, but it's not so bad. I'm able to tolerate. And then there are those who are completely unable to tolerate. And for those, we do have medications that we provide for that.
Something else?
One of the other things is memory loss. So women tend to have poorer memory in menopause than they did previously. It's affected by estrogen, but sometimes it can be genetic, and this is the time, remember, that diseases like Alzheimer's are diagnosed. And so that can be quite a contributing factor to menopause. So this is basically something that the gynecologist needs to take into account in totality, and probably involve a neurologist, a psychiatrist, just to be able to have a a clearer picture of what's going on. And then we also have low libido. That's one of the things that women really complain about in menopause. And not only do they complain about it, but they also miss it. You know, they do miss like having a higher libido.
And also, if you used to have an active sexual life, then
and many of them do want to maintain that active sexual life. And sometimes hormonal replacement therapy does, you know, sort that out. But of course, if you're not a good candidate, there's other therapies, like for example the O-shot, which is a form of platelet-rich plasma therapy, which can be given to be able to increase the libido, to increase lubrication, to remove, you know, pain during sexual intercourse, so to restore orgasms and, you know, make them more intense and more frequent. So that is one of the options that at least we have to be able to
at least it's here, it's available.
Yes.
So a woman doesn't need to suffer in silence. You can go see a gynecologist and they can offer you that option. So the other minor symptom, and not necessarily minor, like Harry said, everyone has different intensity when it comes to the symptoms. Another symptom is mood changes.
Yeah, so women do get a lot of mood changes. They get symptoms that are similar to depression, and this needs to be managed. And sometimes it's very, very difficult to manage that. Many times as gynecologists, we do have to involve a psychiatrist to be able to manage that, so that we see, does she need to be on medication or not for that? Is this something transient? Is this something that's going to last? Especially if there was, you know, a history of mental illness in the family, then this really needs to be looked into. But it can happen, and the reason I'm mentioning it is just so that for women who do find they have mood changes, they don't feel like, oh, this is only happening to me. This is definitely something that's happening to all menopausal women, or a majority of menopausal women. You do go through mood changes, and you have to find, you know, the things that make you happy in life, you know, taking care of your children and your grandchildren, you know, rediscovering yourself, probably traveling.
It's very important.
Yeah, living an active lifestyle, just to be able to help with the mood changes.
Okay. I think that I really tried to expound, and again I'll repeat, menopause is something natural that I think every woman will go through, just how we're created. For me, from what I've gathered today is that knowing yourself, self-awareness, knowing your body, learning yourself, being able to seek help, not suffer in silence. You're not the only one. Probably sometimes if you speak to a doctor, speak to a friend who's gone through, they'll tell you, you know what, this does tend to happen sometimes. Go seek professional help. And that's why Dr. is here to tell women outside there, if it does happen to you, whatever we've talked about today, even if you've not had it in this video, in this session, ensure please you seek help and prioritize yourself. You know, prioritize you. Most times it's when all the kids have grown up, and it's a lot of changes happening at the same time, and it can be overwhelming for anyone, any human being. So like Harry said, and I'll repeat again, there are a group of doctors who can help you and give you menopausal care when you're going through that difficult time. And we always say it doesn't have to be expensive. And we always say information is knowledge. So please ensure you see your gynecologist, you see your physician, and they will be able to guide you on the menopausal care that you need. And every woman's menopause experience is different. I'll let Dr. close and give her last remarks, and as usual we attach her number, her contact, her details, and the location of where her clinic is. And again, we always say go see someone who you're comfortable with.
And I just basically reiterate what you're saying, and I couldn't stress it more. Take care of yourself, know your body, listen to your body, and know that you're not alone, and that the solutions to all the problems are available, and they're available in Kenya.
They are. And if I always say we have talent in Kenya, we have expert doctors, you know, and the good thing about them, they're a community, and if a doctor is not able to do something or it's not within their scope, they're able to recommend, because at the end of the day, their main job is to ensure you live a comfortable life, quality life, and they want you to be able to be comfortable even as you're going through this menopausal period, guys. So ladies who are out there, please know you're not alone. Most of all, you're not alone. Hope you've enjoyed this video, and as usual, we're going to have an IG live to answer more of your questions. Please watch. We shared a lot of information. If you have any questions, note them down. We promise we're going to have an IG live to answer any questions that you have. So until next time, guys, bye.